I'm Dr. Brian Weisman. We all recognize the importance of non-surgical facial rejuvenation. Several years ago, we undertook a project to develop a treatment tip for the ThermoCool device that would allow us to produce non-surgical eyelid rejuvenation. We approached this project very carefully, making sure to establish the safety of this device as well as its efficacy. We began in an animal model, moved to treating excised human eyelid skin, and finally in vivo human eyelid testing. We've now gotten to the point where the vast majority of the patients we treat develop successful tightening of the eyelid skin, reduction of hooding, and a satisfactory outcome. Used appropriately, the thermage eyelid treatment tips can be an important part of the armamentarium for any aesthetic facial surgeon.
On the day of treatment, I typically review with the patient their goals and expectations. We discuss the degree of hooding, tissue tone, eyebrow position, presence or absence of herniation of the orbital fat, position of the tear trough, and other concerns the patient may have. I make certain that the patient realizes that the eyes by thermage procedure does not produce the same results as surgery, Botox, fillers, or other more invasive procedures. The thermage procedure produces results that may vary from subtle to dramatic. These results may be immediate, but do improve over time. Some of the benefits the thermage procedure offers include the lack of downtime, tightening of skin, and reduction in hooding. It is also important to take a careful ophthalmic history from the patients. Anyone who has had recent intraocular surgery, corneal transplantation, or LASIK surgery should have clearance from the operating ophthalmic surgeon prior to undergoing placement of an eye shield or performance of the thermage eyelid treatment. Like all thermage procedures, the proper treatment level setting is determined by using physician assessment of skin thickness, underlying anatomy, and patient heat sensation feedback. Review the feedback chart with the patient to make certain they're clear on articulating the feedback levels throughout the procedure. We use a scale from 0 to 4. 0 is, I cannot feel this at all, while 4 is, don't do that to me ever again. The desired treatment level of 2 to 2.5 is the range in which we feel that efficacy can be maximized while minimizing the risk of complications. Prior to applying the grids, first examine the periocular region and make certain all makeup, lotion, or oils have been removed. Some makeup may contain trace metals. It is therefore imperative that the skin be cleaned thoroughly prior to application of the grid. Begin the grid placement by applying alcohol solution to the upper eyelid using a cotton-tipped applicator. The applicator should be barely moist with alcohol, as alcohol is extremely toxic to the ocular surface. Place the 0.25 square centimeter grid paper on the eyelid and gently roll or dab the applicator over the treatment grid until the ink shows through the paper. Continue the application to the surrounding periocular region using the 1.5 square centimeter treatment grid as a roadmap for ensuring the full surface area treatment. Place anesthetic drops in the eye prior to insertion of the ocular shield. I use 0.5% proparacaine drops and ocular shields manufactured by Oculoplastique. These shields have been specifically designed for and tested with the thermage treatment tip. For ease in placement, I begin by lifting the upper eyelid away from the globe and asking the patient to gaze downward. I then insert the shield into the superior fornix under the upper lid and ask the patient to then gaze upward while I pull the lower lid inferiorly. The shield should then settle into position quite comfortably and should be well tolerated by patients. We've found that it is more comfortable for most patients to have one eye covered at a time, as covering both eyes sometimes leads to claustrophobia. Some important considerations when selecting an ocular shield include the size of the shield and the material from which it is manufactured. Shields should be selected to fit behind the eyelids with as much protection as possible. It is important to avoid placement of shields that are too small, as these can provide a false sense of security. The treatment is begun with the application of a generous amount of coupling fluid to the area that's to be treated. A generous amount of coupling fluid serves to eliminate air gaps between the treatment tip and the skin to ensure proper contact between the treatment tip and the surface being treated. Adjust the treatment settings until patient feedback score of 2 to 2.5 is achieved. Begin by placing the treatment tip on the squares of the grid until all squares have been treated from the lash margin to the transition zone. I like to use either a 4x4 gauze or a cotton-tipped applicator to keep the treated area under tension. This prevents the skin from bunching up and ensures even distribution of energy throughout the treated skin. Once the pretarsal skin of the upper and lower lids, that is, the skin closest to the eyelashes, has been treated with the 1/4 square centimeter tip, remove this tip and attach a 1.5 square centimeter TC tip to the handpiece. The remainder of the periorbital region, including the upper eyelid skin between the upper lid crease and the eyebrow, the lower lid skin over the inferior orbital rim, and the crow's feet region, is then treated using the 1.5 square centimeter treatment tip. You will have to adjust the energy setting on the device in accordance with patient sensation and underlying anatomy. You may find that it is necessary to decrease the energy as you treat the thin skin overlying the bone of the lateral orbital rim. Medical judgment dictates the total number of passes needed to achieve the desired outcome. As I near completion of the first eye, I periodically step back to assess the degree of tightening. At that point, I add pulses to areas needing additional tightening prior to completing the first eye. Next, I like to remove the grid, sit the patient up, and conduct half-time assessment looking for either a visible or palpable clinical endpoint. Treating to a clinical endpoint increases the degree and predictability of efficacy. Once I'm satisfied with the treatment, I remove the plastic ocular shield and repeat the procedure on the contralateral eye. Upon completion of the procedure and complete removal of the grid, I review with the patient special instructions to use artificial teardrops on a regular basis for the next couple of days to keep their eyes moist and comfortable, and to contact us immediately should they have pain in or around their eyes. We also remind patients that the onset of results following the thermage eyelid treatment are gradual but will improve over time. From clinical studies, some patients have reported that their makeup is easier to apply and that friends and family comment that they look less tired.